Good afternoon, Dr. Bindeshwar Pathak ji, ladies and gentlemen. I am Dr. Vasundhara, currently working as a lecturer in sociology at Kuampu University in Shivamogga, Karnataka. I am here to present my research paper, Healthcare Need and Provision for Care for the Elderly, Issues and Challenges. I would like to thank the Sulabh International Social Services Organization, New Delhi, and all the team members for providing me with the opportunity to present my paper. The population of the elderly and their ratio in the total population have been increasing rapidly in the both developed and developing countries. This paper deals with the healthcare needs and provision of care for the elderly with special reference to South Indian states. According to the 2001 census, there are 77 million elderly people in India and about 40% of them are living below the poverty line. Health need of the old woman, heterogeneity of this age group, some are completely healthy, working even now for their livelihood, while others are frail, bedridden, and dependent. The prevalence of the common health problem seen among the other group of elderly like high blood pressure, diabetes, heart disease, etc. is relevant to low among the elderly group. The high morbidity rate among the elderly women can be attributed more to pathological fractures, mobility problem due to the osteoarthritis, cervical and uterine cancer, dementia, strokes, other degenerative diseases of the brain and depression. A health condition like dementia often reduces the elderly competence to carry out their daily life activities, the skipping of medicines, and sometimes overdosing, as well as victimization in dangerous situations like falling from a staircase, getting electric shock, and burn, etc. are common, especially in the case of elderly women with a loss of memory, dementia, and depression, physical and as well as physically care is needed. A high prevalence of depression is noticed among the older women, especially in the widows living alone, which is also a reason for the increasing rate of suicide among them in South Indian states. Elderly abuse it at another problem. It is magnitude range of denying them proper health care, medication, and basic living facilities to dumping them alone in alien surrounding after taking possession of their property, characterizing them as a mentally ill and torturing them verbally as well as physically. Maintaining privacy and personal hygiene is at another matter of concern among the oldest women due to the misconception about aging and the elderly. The caretakers underestimate the privacy and sexuality of the elderly woman. The elderly women to discuss their needs and problems openly with other family members, male doctors, or health care providers affect their initial response to health problem, and this is increasing and severity of the illness. Actual need of the old, home care and mobile medicine care services, regular medical checkups, and provision for assisted device, personal care for the bedridden, supplementary diet, and calcium supplementation, counseling and rendering emotional support, and educating the elderly as well as their caretakers, financial support for meeting medical expenditure, patience, and persistence towards their problems. Provision for care in developing countries where long-term care services and other institutionalized services are available in plenty for physically dependent and weak elderly people. In developing country like India, due to the scarcity of resource and the peculiarity of cultural setting, family still continues to be the main caregiving system for the elderly. 43 of individuals in South India states live with an elder all through. The quality of care they are receiving from the family is depreciating fast. Elderly care is recognized as an economic burden by averaging middle class and poor families. The census report for South Indian status shows that population of the elderly is high in the rural area. The main healthcare provider for the rural population is the primary health center. Unfortunately, the services are organized more towards reproductive and child health programs and policies. Need for integrative approach. The current situation presents new sets of problems and new dramatic challenges to find productive and meaningful roles for older adults in families and community. We need to avoid the stereotypical images of older people and recognize the heterogeneity of these old population. Lack of exactness with the highest literacy rate of 90.9% of in South Indian status, the concept of self-care developed by World Health Organization seem relevant in the discussion of healthcare needs for our oldest population. Panchayat Raj system has really power over the healthcare need of the local population. This can be used for the benefit of the elderly if proper planning is given for the expenditure of the funds set aside for their welfare. The self-help groups of women formed under the poverty evolution program called Kutumba Shri can be utilized for rendering services to the elderly. The providing proper training for the members of this unit, we can transform them into community level caretakers. Member of the self-help group can perform services such as regular monitoring of the elderly health condition and helping the elderly take insulin injection at home, advice regarding to importance to diet, nutrition to the elderly as well as their caretaker, taking them to the hospital or daycare center, etc. Conclusion: health is the heart of human development. Healthcare and health security are the right of older people. So our elderly population in India are become important issue. The government of India has expressed its concern in this regard by preparing the national policies of the elderly. Thank you. Thank you, Ananda.